When I first realised I was contracting it, I was a bit hesitant about how I was going to feel and the symptoms that I would experience. That made me a bit cautious about obviously not doing my day-to-day activities like going to the gym and going to work. But ultimately I know that what I was doing was for a greater cause. My mum said, "You're crazy," but actually the more I tell her about it, the more I think she understands why people take part. My name is Rebecca and I willingly contracted malaria. So the trial that I'm part of involves me contracting malaria 3 times over the course of 20 months with the intention to look at how my immune system responds to repeated malaria infections. And I'm about to contract it for the 3rd time.
Hi, Rebecca, how are you? Come with me. Thank you. You can just come in through here. My name is Jennifer. I'm a clinical research fellow here in Oxford and I work on malaria challenge studies. I'm also a medical doctor and I oversee the safety of participants that are taking part in these challenge studies. And you can just put it under your tongue. Yeah. So a malaria challenge study is where we intentionally infect healthy adult participants with malaria. And we do this under a controlled environment, so in the clinic, where we either inject them with red blood cells that are infected with malaria or via a mosquito bite. These are really just looking at safety bloods. So challenge studies are really useful research tools because they help us to evaluate immune responses to malaria, also to evaluate responses and efficacy of vaccines. So they're really important in the development of vaccines against malaria.
Prior to the challenge, you do go through quite extensive testing to make sure you're a fit and healthy volunteer. Part of that includes going through your medical history and also blood tests and actually completing a test on malaria just to make sure you fully understand what you're consenting to as a participant.
Participants often ask me what is the impact of malaria challenge studies and how do they improve the malaria control globally. So today I've brought Rebecca to come and chat to Melissa. Melissa works in Kenya, which is a malaria endemic area, and she's going to give us a bit of a global context of the impact of malaria. Hi Melissa, thank you so much for meeting with us today. So this is Rebecca.
Hi Melissa.
Hi Rebecca, lovely to meet you. My name is Melissa Kapulu, based in Kenya. So malaria is really a significant global health concern, not only globally, but here in Africa as well. It continues to affect millions worldwide. There's about 240 million malaria infections a year and more than 600,000 malaria-related deaths. Malaria impacts largely children under the age of 5 and more also pregnant women. Now, there's been a lot of efforts that have been going on in the last decades to try and eradicate and potentially eliminate the disease. The good news is that we've had 2 vaccines that have been approved. The downside of these vaccines is that they don't give complete protection. So it means that we need better tools to fight this particular disease. We have other candidates in the pipeline, 2nd to 3rd generation vaccines. The Oxford group under Simon Draper is developing late stage candidates. So that then becomes important to get a vaccine that's targeting that stage to get as many of the malaria parasites that come through an individual eliminated in the body.
I think we're very lucky, obviously here in Oxford, that as part of this trial we've got the support and treatment from doctors and nurses, and it's in a very controlled environment, but it is a bit of a wake-up call to try and understand how people would feel if they didn't have that around us, because it is a very unpleasant and serious illness.
I just want to say thank you for participating in these trials. It's really important. Clearly, we're going into an era where we really want to eradicate and eliminate malaria and have a malaria-free world.
Being able to help other people in other countries is obviously a big motivation. My hope is that the data collected from this trial will help in the fight against malaria. So how are you feeling about the upcoming challenge later today? A little bit apprehensive about it, I think, because I don't know how I'm going to feel, and it's a bit of a strange feeling knowing that you're going to get sick and you're essentially waiting for it to happen. So I think I'm going to be a bit hypervigilant on, have I got a headache or is that malaria? So yeah, it is a bit of a strange feeling. I think as well, the support that you have from the team has really reassured me, knowing that I have a good support network there has reassured me. How does your family feel about you taking part? Not overly pleased. I think it's not a normal thing that comes up in conversation. I'm going to willingly give myself malaria, but I think hopefully once I can share some of the results of the study and they've seen how controlled it's been, that they feel a little bit more reassured. But yeah, I don't think they were overly pleased at the beginning. Today is the day of the malaria challenge. On the actual day of the malaria challenge, you go into the clinic, you have some observations taken and a cannula put in. We then have to wait for the actual malaria to arrive. So at that point, we receive a bit more information about why we're taking part of the study, and also some of the results we've seen from the previous challenge that we've been involved in. We then get injected with malaria.
Okay, so this is now the inoculation that we're going to put. Is that painful?
No, can't feel a thing.
Okay, so it's going nice and smoothly.
And we wait for about an hour and 15 minutes after, just to check our observations again.
In 1 hour.
Okay, yeah, thank you. And then we just go home. So I have just finished at the hospital. It's now 1 week post the malaria challenge, so it's the following Wednesday. I've had 5 days of phone calls in the morning just to check that I'm okay. I'll be back this afternoon for my daily blood test, and at the moment, no symptoms. After being infected with malaria, it can take about 10 days before you actually start to experience symptoms.
I often ask participants how they find participating in our challenge studies, and often they're a little bit scared at the beginning. So as a doctor working in these studies, we're available 24/7 if they need to call us throughout the trial.
So we are now day 10. I'm just about to head to the clinic now for my afternoon daily blood test. No symptoms as such yet. I did ring at like 5 AM one morning. I was like, I feel so ill, please. Just made myself a little coffee, working from home today, quite tired. I had a call from the doctor last night to let me know that I'd hit the threshold to start treatment. So I'm going to be heading into the clinic this morning just to get that medication. Once you do start treatment, then the next 24 hours are probably the worst I feel out of them all. Day 13 since the malaria challenge. Since a couple of hours, I started to feel much worse actually. So I've just had a bath. I just laid in bed. I actually might run another bath because...
So throughout the challenge and the follow-up period, we do a number of different tests. Some of those are purely safety tests, but some of those are also looking at the parasite count, and this is really important in the diagnosis of malaria. We also look at the immune response during the challenge and the follow-up period. And here we can look at a variety of different immune cells and see how these are reacting to the body having malaria.
I feel a bit better this morning than I did last night, which is good. Hoping today I start to feel a little bit better as the day goes on and obviously the medication kicks in. I'm actually really glad I took part in it. I have felt well supported throughout. It's definitely opened my eyes to how serious malaria is.
Volunteers like Rebecca are really important to malaria studies. There are a number of challenges in the fight against malaria, such as the development of resistance against insecticides and also resistance in anti-malaria medication. And this is really why vaccines are so important. If I had a message for participants, your contribution to this work really improves the control of malaria worldwide, and it really does have an impact.
It feels good to be part of this. Everyone who I've spoken to about it, my family, my friends, they've never heard of this before, and they're also quite intrigued and surprised that these types of trials take place. So it does feel good to be part of that.